Do you ever feel out of breath from things that used to be easy, walking to the kitchen, climbing a few stairs, or just carrying a bag? That could be more than low stamina. It could be COPD, a condition that quietly steals breathing capacity over time. Give me 5 minutes, and you'll understand what COPD is, the early warning signs, why it happens, and what actually helps. Why COPD matters. COPD is often underdiagnosed, and many people don't get evaluated until symptoms are more advanced. Early detection matters because getting diagnosed sooner gives you time to slow progression and protect lung function. What COPD is? COPD is a group of conditions that cause persistent airflow limitation due to long-term damage in the airways and lungs. It commonly includes chronic bronchitis, ongoing airway irritation, and mucus and emphysema, damage to air sacs that reduces oxygen exchange. In COPD, air gets trapped. Breathing out becomes harder, and you feel breathless. Common symptoms plus early signs. Common COPD symptoms include shortness of breath, chronic cough, coughing up mucus, sputum, phlegm, wheezing, and chest tightness. Many people first notice breathlessness during activity, then gradually it can show up with later tasks. Don't ignore a long-lasting cough with mucus. Getting checked early can prevent lost treatment time. Shortness of breath, chronic cough, coughing up mucus, phlegm, sputum, wheezing, or chest tightness. Causes and risk factors. Why COPD happens. Doctors look closely at exposure to lung irritants, especially cigarette smoke, when evaluating COPD. Other risks include long-term exposure to irritants like secondhand smoke and certain workplace dust, fumes, or chemicals. Some people may also have a genetic cause called alpha-1 antitrypsin deficiency, which can be checked with blood testing in the right situation. Tests that confirm COPD. COPD is commonly confirmed with spirometry, a breathing test that measures how much air you can blow out and how fast. Clinicians may also use pulse oximetry to check oxygen levels, and imaging like a chest X-ray or CT scan to evaluate lung changes and rule out other problems. COPD can be hard to diagnose because symptoms can overlap with other lung conditions, so objective testing is important. Treatment and daily management. What actually helps? There's no cure for COPD, but treatment aims to control symptoms, improve daily function, and reduce exacerbations, flare-ups. Common treatments include inhaled medicines like bronchodilators that relax and widen airways, and sometimes inhaled corticosteroids to reduce airway inflammation in people who have frequent flare-ups. Pulmonary rehabilitation combines education, exercise training, breathing techniques, nutrition advice, and support, and it can improve quality of life and help people do more day-to-day. For some people, oxygen therapy may be part of care, depending on oxygen levels and severity. COPD management isn't just one inhaler, it's a plan, and the plan can give you your life back. COPD flare-ups, exacerbations, and when to seek help. Flare-ups are periods when symptoms suddenly worsen, and they may need extra treatments, such as medicines, oxygen, or hospital care depending on severity. If breathing suddenly gets much worse, mucus changes color, thickness with infection signs, or you struggle to speak due to breathlessness, seek urgent medical care. Breathing better starts with one decision: take symptoms seriously and take action early. This video helped you understand COPD. Please like, share it with someone who needs it. Follow for more health education, and subscribe because the right knowledge at the right time can change everything.